This evening, our presenter and facilitator is Dr. Michael Powell. He's a veterinarian and co-director at the Lincoln Institute of Veterinary Business. Welcome.
Thank you so much, Kathy. A huge welcome to you all. Great to have so many people on. Gosh, I don't even know what those numbers look like, but I think we've got a very good turnout, which is excellent. Still got a few people making their way in, but I might just kick off with a bit of an introductory spiel with you. So as Kathy's pointed out, my name is Dr. Michael Powell. I'm a veterinarian and have been for nearly 30 years now. Gosh, that sounds scary when I say it like that. And I was lucky enough to meet many of you at our intro webinar. And yeah, it's my pleasure as one of the directors of Lincoln Institute and one of your leading edge facilitators as well, to be here with you. And I just wanted to start by saying how delighted we are to be working with all of you and see how well that you're engaging with the program so far, and equally to see how committed so many of you are coming along to this webinar tonight or this evening or this afternoon, wherever you are. And we certainly intend to honour that commitment. And it's my pleasure to be presenting to you all about the power of mindset. This is an often overlooked yet powerful force in our personal and professional lives. And my role in the first part of this session is to do a deep dive right inside the mind of a typical veterinarian. We're going to go beyond the scope of Leading Edge and share a few additional insights as well. And we'll do some critical peer-to-peer reflection. On that basis, just a reminder that this is going to be fairly interactive. So please make sure that you are in a position to, at the very least, switch your microphone on around the midpoint of the webinar. Ideally, it would be great for the people that you're paired up with to have your video on as well, but we appreciate some people just aren't in a position where they can do that. So if you're not in your PJs and you're not tending to children simultaneously, please switch your video on as well, at least for that point. Now, Denise, can you see my screen share okay there?
I do.
Okay, fantastic. Just get myself a little bit organized here. Okay, so also just a final reminder, I think we've got just about everybody in that we're going to have in, that we're going to have a Q&A at the end. This may run slightly over the 60-minute mark, so please drop off if you need to, but I'm really committed to sticking around and answering all the questions that this particular presentation might stimulate. So to start with, I just wanted to say one of the reasons we chose this foundational subject of mindset is because it sits at the heart of one of the biggest challenges our industry has ever faced, being a global shortage of veterinarians, driven by what most studies would suggest is unprecedented levels of professional dissatisfaction and subsequent attrition. So what I'd like to do firstly is analyse some data with you. And this is data that really fleshes out the foundational challenge a little bit more. And I'm going to share with you some key findings that relate to a research project that I was responsible for, which explored professional satisfaction, well-being and attrition. We called it the 2021 Veterinary Sustainability Survey. Now, this research was in part performed as a longitudinal follow-up to our 2018-2019 Veterinary Shortage Survey, which was 1,500 veterinary professionals across Australia and New Zealand. However, in this 2021 research, we extended our reach to 12 other countries around the globe, including a handful of submissions from Canada as well, you'd be pleased to hear. And for the purposes of this presentation, I'm going to present the responses from the 375 employed or formerly employed veterinarian respondents to some key points. And as with our 2018-2019 work exploring attrition in our region, some of the key findings were really quite disheartening. As you can imagine, with the follow-up survey on attrition, it was important to note that we explored once again this concept of satisfaction with the professional together with the statement, "I am considering leaving clinical practice altogether in the next 12 months." Now, while the response rate had reduced from the 30% as it sat 3 years prior, disappointingly, 24% of veterinarians still indicated that they are planning on leaving the industry altogether. This was nearly not far off a quarter, and it was mirrored in studies globally. Certainly studies since as well. In the 2023 research by the American Animal Hospital Association Path to Better Retention in Veterinary Medicine survey, suggesting that that percentage was nearly 30% in the US at the very least. Next, we wanted to understand why, after often 6 or 7 years of study and often hundreds of thousands of dollars spent on this education, veterinary professionals were ready just to walk away. And as you can see, there are a significant number of reasons broken down here, arranged in a rank of percent of total responses. And I draw your attention to the number one reason sitting there. As per 3 years prior, in first place of reasons for considering a departure was stress and anxiety in their current role. And as you can see with this question, further to stress and anxiety being the top attrition driver, we probed how many veterinarians were experiencing stress and anxiety on a regular basis in the course of their veterinary work. And an alarming 81.1% confirmed this was the case. This figure had jumped sharply from 44% just 3 years prior. So no doubt being reinforced by the commentary that we actually received in the survey. This was in part exacerbated by the additional pressure during that point in the pandemic. What most developing countries experienced was the pandemic boom in demand for veterinary services. And here are the top 11 stresses as selected by them. And interestingly, the emphasis on these stresses, particularly the top 5, remains largely unchanged from our 2018-2019 work. And of these top 11 stresses, the top 9 all relate, at least in part, to deficiencies in non-technical competencies, exactly what Leading Edge was created to target. So while there are so many interesting insights here, I want to draw your attention to the combined 4th and 5th position, where we have responses that relate to financial mindset and self-worth. This is a combination of the stress of difficult conversations around the cost of our ethical treatment recommendations, plus the moral and ethical stress of compromising standards due to perceived financial constraints of owners. And I say perceived here because in the commentary, many veterinarians use the words, what I think they can afford, not what I know. Interestingly, when we combine these two responses, challenges with money and the cost of veterinary care was the most significant source of stress and anxiety. And by connection, the ultimate consideration of leaving the profession altogether, even outstripping the stress of time pressure, which we're going to be covering in another deep dive with you. So, to understand the origins of the deeper psychological drivers of this difficult relationship we so often have with finances and money, it can really help to look at the classic personality profile of the veterinarian. So at Lincoln Institute, we teach a profiling system called Social Styles. It was created by Marilyn Reed. It's very similar to DISC. Perhaps some of you have heard about DISC. And it relates to how you interact, communicate, process, and decision make. And what it tells us is that most of the population can be broadly categorized into 4 main personality styles or social styles. And the axes that you can see here in this diagram in the vertical is that continuum between being more passive style personality with assertiveness at the other end, and in the horizontal axis being more people and feeling oriented versus being more task oriented. Now I'm going to do a little running poll here. I want you to open up the chat box if you can. And what I would like you to help us with, while I continue to break this down a little bit more, can you type into the chat box what social style you think you might be? If you haven't been through this exercise yet, just do it. Give it your best guess based on those horizontal and vertical axes. And Denise, in a moment, I might ask you to share with me what our results were. But while I do that, I just wanted to share with you our results based on profiling individuals, veterinary professionals for nearly a decade in Lincoln Institute, and for much longer prior to that, I used personality profiling as a leadership tool for helping us better communicate, educate, motivate, and congratulate our employees when I was a veterinary business owner. But what I certainly have identified across those couple of decades in exploring social styles is that the predominant spectrum of profiles that we might see in a group of veterinary professionals, particularly veterinarians such as yourselves, would be about 3% drivers, 12% expressives, around about 50% analytics, and 35% amiables. And if we looked at support teams, this changes slightly. Amiables tend to be the majority, with analytics at about 25% and amiables sitting at about 60%. Denise, roughly with your best guesstimation, what are the breakdowns there of social styles?
I would say we're probably around 30% amiable. There's probably 25% analytic. We have about 25% driver, and then probably a bit more driver than that, actually. And then we have the rest being analytical.
Fantastic. And what we tend to see is certain social styles get drawn to sometimes to positions of responsibility, particularly drivers, a little bit with expressives as well. And it might be a little bit of a reflection of some of the people that we've got with us this evening, including CVMA Council members. But thanks, Denise. And thank you, everybody. That's really helpful, having an understanding there. One thing I do want to share is that a key finding after well over 2 decades of studying social styles is this. And you can see in this slide, if we combine both the expressors and drivers, on average, we would tend to see these more active and assertive personality styles enjoying better patient outcomes through success in advocacy. And what tends to come with that is more professional satisfaction. The cages are full of their cases. Clients typically love them, even though they're charging very well for what they do. And with the expressives, this is through influence. Their ability to influence is more along the lines of you want this. With drivers, they're great at compelling. They tend to speak along the lines of you really need this. But on average, their outcomes tend to be better. Certainly in terms of getting yeses in the consulting room. But these naturally gifted salespeople only make up a small proportion, typically, of a group of veterinarians. Roughly half, if we look at the people and feeling orientated side of the continuum, are relationship oriented. And what that actually means is that they have a strong need to be liked. And this is often driven by a subconscious fear of rejection. They also tend to have a strong social conscience and a high level of empathy. And then if we bundle the more passive, thoughtful personality types together, this is typically the majority, about 80 to 85%, tend to be more thoughtful and less assertive types who tend to, on average, there's always exceptions to the rule, be lower in self-worth and have a strong aversion to conflict. They also tend to be more introverted, so they find working with people actually quite exhausting. And this is, just remember, this is the overwhelming majority, but there are exceptions to the rule. So let's look at the day-to-day experience of veterinarians whose reality is influenced by these deep-seated psychological drivers. And what I want to do here is focus on in-practice behaviour, particularly behaviour that inhibits longer, more healthier and happier careers. Because this strong empathy, fear of rejection, low self-worth and fear of conflict can manifest in specific ways, mostly relating to our relationship with money. Now, we're going to run through these one by one, and as I articulate these, I want you to do me a favour. Once again, go to your chat box and please type in a yes or a no if they've been part of your experience at any stage. Either you've been guilty of them yourself at some stage in practice, but more importantly, if you've ever witnessed them in others. That'd be really helpful. I'll give you the first one. The first one is providing discounts for no real reason. Now, this is a common behaviour in veterinary professionals. And as you've learned in Leading Edge, so often we have a psychological price point in the services that we're delivering, which can lead to us having difficulty in charging appropriately for all that we do. An example of this might be a medical case that's on day 3 in hospital, and you might just give them one injection. You're giving them 4 injections, but you might charge just 1 injection fee instead of 4 because they're great people and you want to help them out a little bit. And the bill's getting up there, right? Or maybe it's a medical patient coming back for a re-examination and you just run a little sneaky urea and creatinine. You don't charge them for it because it's probably more for your benefit for them than for them, right? These are nice people. We want to help them out. And, we might sleep a little bit easier if we do these things as well. So, Denise, how many yeses and nos, roughly?
Roughly about 70% yeses and 30% no.
Okay, fantastic. How interesting, because I'm sharing some data on the screen there with you as well. For those that admitted to being guilty of this or witnessing this, at the very least, you are not alone. Of the 375 vets across 12 countries we surveyed, 70% admitted to providing service components and intentionally not charging for them. Let's try another one. This behaviour is inadvertently, and I put that in inverted commas, missing fee items when creating invoices or estimates. An example here is that you might provide a recommendation. The client then may ask, what's this going to cost? So often we respond with a number that is our quote. But as a result of strong empathy, this is often in part our best guess at the costs combined with a sense of what we think they can afford. We call this mercy billing. You might have heard that term. And so often what happens with mercy billing is the required treatment exceeds the quote. And as a result of fear of conflict, we often don't even phone the owner to discuss extending the budget at all. We don't check if they'd be concerned or able to afford it, but we just provide it anyway, and a discount's applied at discharge. This is commonplace, and it's often done with the consent of management or without. All right, team, how did we go? Yes or no? Anyone familiar with this behaviour? What would the percentages be, Denise? Roughly.
Pretty close to that, 50-50.
Isn't that interesting? I should not advance the slides so we don't get any confirmation bias there, but interestingly enough, you can see that for a significant proportion of veterinarians, this behaviour resonated for them in our survey, similarly as it did for you. Yes, roughly a 50-50 result there too. I'm going to give you another one now, and this is leading clients and patients to the cheaper or the cheapest approach first. So in this corner cutting scenario, just type into the chat box there a yes or no if this one resonates for you. In this corner cutting scenario, we ignore best practice because so often the fear of rejection is actually so strong that we just assume what they can afford. And we provide the most affordable recommendation up front without discussing the superior and highest cost approach first. How'd we go, Denise?
Well, so far, everyone who's responded has said no.
Good. What that possibly means is also perhaps the leading edge training is providing some benefit, but obviously you've learned better in your time in veterinary practice as well. As you can see here, based on our research, this is actually a really common issue for a typical group of veterinarians. We would see about 40% admitting to omitting or de-emphasising premium healthcare elements based on an assumption of what they think the owner can afford. We all appreciate how dangerous this exercise is, attempting to prejudge what a client perceives as valuable and by connection are willing to spend. The next one's feeling guilty for charging properly for services rendered. So in this scenario, we might recommend the best, we might charge appropriately, but we still feel guilt in presenting a sizable invoice. Just type a yes or no in there for me. Despite our expertise, we so often struggle to charge appropriately, and our biggest concern is burdening them with expense. This is our empathy in play. And because of our fear of conflict or rejection, this is self-worth once again, is so strong. So once again, it's a reflection of this challenge in our relationship with money being the biggest stress and anxiety trigger. How'd we go, Denise?
I think we're about 60% said yes and the rest said no.
Well, as you can see from this result, nearly 3/4 of the veterinarians out there that we surveyed are grappling with this guilt of fear when discussing money with clients. So not far off our little mini poll here. and is only the significant minority, typically personalities in the assertive, active end of the continuum, what at Lincoln we call drivers and expressives, who are okay with it. Here's another one, hating asking for a sale. In this scenario, we may have made recommendations for a companion animal or livestock, and we still feel tremendous discomfort providing the price and asking for the go-ahead. Sometimes what we do is we soften the blow, don't we, with vague inferential language like we've discussed in Leading Edge, like you could possibly consider, or at some stage you might want to think about. And we avoid cutting to the chase and asking whether or not they want to book in. In other cases, we might ask but still feel incredibly uncomfortable. Denise, what were the results?
The results were about 50-50.
50-50. Let's have a look. Not too far off as well. As you can see in our research, a significant proportion of veterinarians at 40% are aware of this discomfort and recognise that concern for causing them expense. So if there were some yeses to this behaviour in your experience, this is what we'd expect. So these are the behaviours that we're seeing play out in practice in far too many clinicians' daily experience. What's actually happening here with these behaviours is usually a direct manifestation of a deeper shift that can occur with our why. So when we couple our often innate aversion to conflict and our fear of rejection with repeated exposure to stresses, such as perceived rejections, compromising care, emotional manipulation, a mindset shift can actually occur. So what actually happens with this shift is ostensibly a switch from our major focus on patient advocacy, transforming into a major focus on low-cost solutions, often irrespective of understanding the client's financial means. Our why that drew us into practice in the first place will have been something like, I want to produce amazing health outcomes for animals and be the advocate for my patients who have no voice. But if we're going to be really super honest here, over time it changes to something like, I will find the lowest cost solutions for clients so I can avoid any conflict or rejection. Okay, on that really cheery note, it's almost time for a breakout. Denise, I might get you to organise some rooms, probably about 3 people to a room. I might get you to set it for about 7 minutes for me. And I'll just give everybody their instruction now. What I would like you to do when you're in this breakout room with your colleagues is share your reflection on these typical veterinarian behaviours arising from these psychological traits and this mindset shift that can occur. Were these or are these still something that you've grappled with, and perhaps has the education that you've learnt in Leading Edge so far had any impact on your awareness of these? And the fact that they are actually limiting behaviours. So I encourage you not to be embarrassed and to share and be really honest, because we're all veterinarians here, we can relate. And yeah, once again, don't forget, switch your microphone on, and if possible, please switch your video on. I can see a lot of you have your videos on. It's so lovely to see your faces. And yes, don't forget, as Denise sends you into these rooms now, just select the agree button to the request to go to the room. All right, Denise, we're ready to go.
Excellent. Here we go.
Welcome back, everybody. As you're all sort of filing back in, I'd be really interested if anyone was happy sharing how their conversation went, and perhaps any light bulb moments or interesting discussions that you had. You could type it into the chat box if you don't feel like unmuting, but if you're brave enough, maybe unmute and share with us. Anybody happy to share? Welcome back, everyone.
Hello.
Hello.
Hello, Mutabed. Are you
Hi.
happy to share how your conversation went?
Yeah, it was good. We just exchanged some thoughts. Most of them were pretty resembling. Like all of us had a common point at some point, but yeah, with a little bit of difference. So the most common thing was the fear of rejection, and feeling more empathetic for the client than the pet. And also there was one more point, that the older vets, older vets and the more experienced vets, because they teach you like this, like give them the option of cheaper thing first, and then go for the other options, and put more pressure on the one that is cheaper, so you can try that first and go to the other option later. So yeah, that is what we discussed.
Fantastic. Thank you so much for sharing. You know, as I said earlier, it never ceases to amaze me, having worked on educating veterinarians in 27 countries in the world and been in breakout rooms plenty of times, just how common our challenges are and how similar we are as professionals also. So it doesn't surprise me, Mudabir, that you found a lot of common ground with that group that you're in. And absolutely, you know, taking that step-by-step approach in terms of moving through treatment options and articulating, you know, where they're situated in terms of the range of potential paths forward is one way of definitely handling it. Okay, thank you for sharing there, and thank you everybody for that breakout room. And I hope it was really beneficial. And sometimes just knowing that not the only one encountering these problems can do wonders in terms of our sense of well-being. All right, so what I'm going to do is just share the screen again. Hopefully you can all see that.
Yep, it's there.
Because we've spoken about where some of these challenges come from. What I'd really like to do with our remaining time left is actually talk through what can we actually do about these if, you know, some of us are still encountering challenges. And, you know, in particular, what do we do? And this can happen at any stage in your career, by the way, this mindset shift that we spoke about. What can we actually do about it if we've discovered our mindset has shifted to more of an unhealthy one? What can we do to get it back to a healthy one that's conducive to more success, fulfillment and well-being in veterinary practice? So I'm going to work through 3 broad steps with you, some of which may be familiar already with the content that you've been through, and they are recalibrating your why, adjusting your lens, and adopting success habits. So the first step in this strategy is recalibrating your why. And we did recommend that you watch a video on YouTube. I'm not sure, maybe you could type into the chat box whether you did follow those instructions and watch a YouTube on this gentleman by the name of Michael Jr. And in this video, what he actually says is when you know your why, your what has more impact because you're walking in or towards your purpose. It was a great video. Did anybody type yes into the chat box there?
Yeah, we had someone. So can you hear me?
Yeah, I can, Denise.
Okay, sorry. I have a yes.
Okay, thank you. So maybe one person has. So if you haven't, definitely look this up on YouTube. Just type in Michael Jr. Know Your Why. Fantastic video. Really what he's talking about is, in this video, he demonstrates with the gentleman that sings a song to the entire audience after being asked to get really in touch with the deeper why. And what we're speaking about here is if we can get in touch with our deeper why and really radiate it, clients actually trust our intent and are more inclined to say yes, which rather ironically keeps us feeling as though we're tapping into purpose. So it's a virtuous cycle, particularly compared to what happens when we radiate a mindset shift to financial and conflict fears. So this first step of recalibration is typically achieved by regular exercises in reflection on your purpose. So that could be journaling, mindful practice, reflection with a buddy or as a group. And a great question to ask yourselves or yourself in this process is, can you remember what drew you into the profession in the first place? So that's typically where your why sits, and has your mindset shifted towards the work that you do? Think of examples where you've actually been achieving your deeper purpose and what you're grateful for. And don't forget that self-care plays a big role in your ability to recalibrate. But that's a topic for a whole nother webinar. If we look at step 2, the lens through which most veterinarians see their profession is quite often out of kilter with reality. And this is in part due to what our fears lead us to focus on. Focusing on saving money to avoid rejection is focusing on the wrong thing, as we've already shared in the program with you. Numerous studies have shown cost is not clients' number one priority when it comes to compliance. Most of the work on this over the years has been done by the American Animal Hospital Association. Particularly interesting study was the compliance study in 2002, and it's been echoed in numerous others since. The majority of veterinarians, 90%, felt the biggest premium healthcare compliance barrier for pet owners was money. The number one barrier, as indicated by those clients that were surveyed, the clients of these veterinarians, was identified as communication. Specifically, a clear recommendation not being made properly in the first place. And this comes back to our preconceived notions of what clients want and opting not to burden them with an expensive recommendation or not articulating it in a way that the client understands or remembers. It also goes back to being uncomfortable asking for the sale or offsetting that discomfort by offering multiple options simultaneously, and the client leaves without a next step, or through confusion defers that decision, just saying, you know what, I'm just going to think about it. Or I'll check with my partner, or I'll get back to you. Interestingly enough, in that same study, pet owners, the clients of the veterinarians, said that cost was only an obstruction in 4 to 7% of the cases, and this really depended on the type of recommendation. The overwhelming majority said that they'd take up the option if we recommended it and actually ask whether or not they wanted to book in. This massive perception disparity shows just how off kilter our focus is. Probably as a result of impacts of previous rejections and emotional hooks, we're spending the majority of our time worrying about affordability when the irony and the sad reality is that's not actually what matters most to clients. And this extends to choosing a veterinarian as well. The mega study in 1999, the Bayer veterinary usage study in 2011, both of these showed that price comes way near the bottom of the list when choosing a vet. For example, client experience, reputation, location, hours, parking, all were way more important. And likewise, when it comes to customer loyalty, the 2015 State of the Industry report echoed previous findings. Only about 10% of clients leave us because of cost. At the top of the list, almost 3 times the number as cost, was communication. So we need to adjust our lens, stop judging our own worth on the minority who don't value us, regardless of what their feedback might be, and rather focus a frame on the majority that do value us. Even if they don't articulate it, the majority do. We also need to reframe clients complaining about costs. Remember that the majority are only doing so because they haven't been communicated the value yet. It's really worth writing down. By and large, successful, fulfilled veterinarians are influential communicators who master the art of conveying and articulating the perception of value. It was certainly the case for...
So sorry. We do have a question regarding this. Can you please give your definition of client compliance?
Okay, so in that particular study, that was a client actually saying yes to a treatment recommendation. And there was a range in that study, including dental recommendations, diet recommendations, a whole range. Hopefully that helps. Let's keep rolling. And thank you for your questions. And please, if you have any more, just type them into the chat box and I will definitely get to them in a moment. Okay, so the third success habit is this. Creating success habits can silence that fearful voice within. Rejection, not being worthy, conflict, failure. That's another big one for perfectionists. While naturally influential vets aren't burdened with these limiting beliefs, the good news is even if we don't like sales or influencing people, we can build our skill and silence those voices with great habits. It's a great quote by Aristotle there. We are what we repeatedly do, and excellence then is not an act, but a habit. Lincoln recognizes that the talents that correlate with professional success have less to do with your university GPA, but rather our mastery of non-technical competencies. As I said earlier, these come naturally to a minority. That might be managing your time, getting more yeses in the consulting room, leading your team more effectively. Perhaps it's being more resilient in practice, but the good news is, like any skill, it can be taught. And that's what your leading edge training was actually designed for. So if we take patient advocacy success, for an example, or if we want to use that term, compliance, getting more yeses. Through following strategies and systems, you can actually create a habit, be it in the consulting room or on a farm visit or over the phone. You can follow a series of steps which become habitual. So you don't need to think, and it makes the process easier and more comfortable. But more importantly, success breeds confidence, and confidence breeds further success. So once again, we're supporting a virtuous cycle, if you will, compared to the vicious cycle tied to the no's that we will receive. And here's the kicker. Clients say yes more when they feel your confidence. So when you deliver with self-belief, without non-verbal cues of apology or fear, plus when we're radiating our passion with the why that we mentioned earlier, clients are more likely to move forward with us because we're actually registering in the decision-making center of their brain. And if anybody's experienced this virtuous cycles since starting the program and learning about this in the training, please just type yes into the chat box for me. It'd be interesting to know. And while we wait for some of those to flow through, it's fantastic. I'm seeing some yeses there, which is brilliant. A great way to help demonstrate a system that can become a success habit is by reviewing something we call the 6-step consult mastery system. It's been explained over many modules in Leading Edge, but I'm going to pull all of this together for you. Thank you. Still some yeses flowing through, which is brilliant. And the first step, please write these down because this is going to be helpful for you. This is going to piece it all together. The first step is what we call setting the intention. So what we're doing here is we're really setting the intention mentally for success. Regardless of how woo-woo this step is going to sound to you, it's now scientific fact that mental rehearsal like this leads to better professional outcomes. Well, this used to just be a habit of professional athletes. Mental rehearsal now is part of the preparatory routine for high performers in a range of disciplines. Medical professionals, executives, entrepreneurs, entertainers, this is what they do. Michael Phelps, the most decorated Olympian of all time, attributes so much of his success to mental rehearsal. He'd often spend about 1.5 to 2 hours of mental rehearsal before a big race. So why does it work? Well, without diving too deep, intention setting, mental rehearsal works because when we take the time to really clearly visualize the process we're about to engage in, drawing in the senses, imagery, and emotion, the brain can't tell the difference from the real thing. And it's been demonstrated in MRI studies that the same neurons and pathways are activated as when doing the real thing. So what could this look like for you? Well, if you want to achieve exceptional success when consulting, whether it be in the practice or on farm visits, we need to spare a moment for getting extremely clear in our minds before each interaction with a client on things like, what are the outcomes we're going to achieve for the patient? Preventative healthcare, medical care, nutrition, herd health. How about for the clients, their customer experience? How are we going to engage them? What's our communication going to be like? But also spare a thought for ourselves. What's this going to look like in terms of fulfillment, success, maybe boundaries? I'm not talking about sitting in the middle of reception in the lotus position. Maybe it's in the car before setting off for a day of house calls or farm visits. Maybe it's 1 minute alone in the consulting room or the exam room at the start of the consulting block. Don't underestimate the power of setting a clear expectation when it comes to success and fulfillment. Step 2 is building rapport. Now, having taught this 6-step technique to dozens of veterinarians that I employed and now over 1,500 veterinary professionals, through the work that we do at Lincoln with practitioners around the world, from experience, this is an area, step 2, that is so often neglected for veterinarians experiencing professional dissatisfaction. Because you see, skills in rapport building come naturally for the extroverted amongst us, but much less naturally for the more introverted or task-oriented on the continuum, which, as we shared earlier, accounts for the vast majority of us. And when we couple that with the added layer of time pressures, it's so often not receiving adequate or any meaningful focus. But the good news is techniques can be learned to very rapidly build rapport, and you're going to be exposed to nearly 6 modules in the program dedicated to maximizing client experience. For example, verbal and non-verbal communication strategies, active listening, moments of truth, social styles. So hopefully you will have this step covered. Step 3 is creating the need. Essentially, this is the clinical examination, however, done so masterfully. Part of this process, done well, is about making the unseen seen. You've heard that term already. We're talking about communicating the examination process and its value. Examining out loud is the way I've heard this described by a colleague of mine. And ironically, we're invariably so adverse to being perceived as expensive, and maybe we're a little bit in a hurry as well, that we literally have a habit of downplaying the value of the amazing service elements that we're providing. A simple example of consulting out loud here is articulating an abdominal palpation on a dog or a cat. We're turning what seems like a rapid and perhaps random series of pokes and prods into a systematic and deliberate examination of the abdominal cavity by talking them through it. The more valuable these processes appear, the more they appreciate your ultimate recommendations and the costs associated with them. At Lincoln, we also describe creating the need well as treating what's in front of you. And that means being comprehensive and uncompromising with any abnormalities that we find, not letting that fear of rejection stand in the way of being the ultimate advocate for that patient's well-being, and presenting that information in a way that's compelling and not overwhelming. Power of legitimacy has been scientifically proven to help here too. Documenting written findings and recommendations into a report for them leads to less confusion, greater perceived value, and improved compliance. And to this end, having a templated examination report form like the PET report card you can see on the slide can support that consulting process. Step 4 is called warming the need, and this is about delivering recommendations in a highly compelling way. It's another area where the typical veterinarian has such a huge opportunity to improve results. Warming the need is all about more effectively tapping into the decision-making center of our client's brain, being the limbic system. The opportunity we have here is summed up really well by Simon Sinek in his book Start with the Why and his concept of golden circle theory. What he says is this: instinctively, so often we give our clients the scientific reasons and facts first. Data, diagnostic evidence, pathophysiology, statistics. That's the what and the how, which, if you remember, is speaking to the neocortex. If we do touch on the why, it's often brief and still sometimes a technical, less emotive delivery. For the majority of the more task-orientated clinicians out there, the warm, fuzzy stuff like this is so uncomfortable or unfamiliar, it doesn't get much of a look in at all. But if we used an example of a companion animal dentistry recommendation, we need to think of moving away from the standard what and how heavy approach, which is so often along the lines of, well, Margaret, I'm seeing gingivitis and calculus here consistent with grade 2 periodontal disease. I recommend we perform a dental prophylactic treatment under general anaesthesia to eliminate progressing periodontitis, irreversible periodontal detachment, and premature tooth loss. Now that's accurate, right? But if we want to get way more bang for buck, we need to be moving to a slightly simpler, more of a emotive approach along the lines of this. Margaret, it's clear to me Fluffy really needs urgent dental treatment to remove all that terrible infection in his mouth that we can see and smell. While he's been putting on a brave face, his gums will be really sore. This treatment's going to ensure that he's not in pain in and around his mouth anymore, and better still, this will get him to a point where you won't mind getting up close for cuddles and licks, with his breath back to what it was like when he was a puppy again. So which one of these approaches is more likely to produce the required emotional response for a limbic-driven decision? It's not rocket science, is it? 5th step, asking for a sale. We've actually got to ask for the sale. We need to move beyond the vague language of conflict avoidance, things like might think about, could do, should consider when making recommendations, or worse still, not recommending action on it at all. And at Lincoln, we teach about using compelling language like the word need. Margaret, this is what we need to do. Is that okay? We also teach the power in presenting the best care solution and letting the owners decide. An important part of this process is demonstrating the value of the treatment components within that plan. As we describe it, this is making the invisible visible during this communication. But more importantly, once the demonstration of the value has occurred, actually providing the owners with the estimate of the cost and giving them the opportunity to book it in and have it done. We need to resist the temptation to fill that uncomfortable silence. Usually we do that by simultaneously offering options B through to E. Spectrum of care still has its place, but The better way to go about this is if the owner declines option A, then move on to B, and so on and so forth. Well, one reason clients decline is buyer's remorse. So the final step is addressing objections and avoiding this remorse. What happens with buyer's remorse is clients have second thoughts once they get home and sometimes cancel. And we teach strategies to significantly reduce that likelihood. Most important one is acknowledging the key need of a client to feel certain. We can do this by offering to address any final questions that they've got up front, as well as reassuring them and future pacing them on having no regrets. So a simple final statement like, Margaret, you're not going to regret this decision. At the very least, you'll get tremendous peace of mind knowing that you've done all you can for her. This can go a long way to both eliminating doubts that might creep in about moving forward and preparing them in an instance where outcomes are uncertain. So that's about all we've got time for. And just a quick recap, though, on creating a powerful mindset shift. The key take home is this. Vets can move beyond these fears and frustrations we've identified that cause them stress, anxiety, and ultimately destroy well-being in careers. We know this because this is what I did for over a decade as a business owner and what we do now at Lincoln, and it's liberating. So start with these steps. Recalibrate our why. That's getting back in touch with our purpose, adjusting our lens, focus on what really matters to clients. That's communication. Develop success habits. Practice these strategies until they become second nature, and success breeds confidence, which breeds more success. So thank you for your attention and engagement. I hope we've managed to add more value to you. And in fact, it would be really helpful if you could type into the chat box if this webinar has been valuable to you and you learned something beneficial. And we might use your comments to encourage others to take part next time. And don't forget, we've got 5 more of these deep dives to go, including one happening in roughly, that's in 2 months' time. Is that right, Denise?
Yes.
We'll give you all the details about that one, and it will be on another critical non-clinical competency that was sitting at the top of the key stresses and anxiety list that I shared with you earlier. And we'll give you more details of that soon. But what I'd love to do now is open the floor to some Q&A on perhaps what we covered tonight, or perhaps alternatively specific strategies you haven't learned yet in the course so far. Really open to you asking anything. Maybe there's some chat that's already happened. Denise, I'll let you facilitate this Q&A.
There is a question that did come in earlier, and here we go. How do one create a need when dealing with a nonchalant client with an aggressive patient, example dog?
So if I understand that question correctly, we've got a nonchalant owner who perhaps isn't demonstrating that they feel a sense of urgency or importance in relation to this, with the added complication of an animal becoming aggressive. I think the answer, once again, is adaptive communication. One of our challenges, if we're going to be a successful patient advocate in the consulting room, is trying to read things like what the social style of that particular client is and adapting our communication to better tap in to whatever their key motivations are. I think that really is the secret, trying to understand what does actually matter to them and frame up that need in relation to those motivating factors. It's tricky, but with experience over time, we can definitely adapt our communication to resonate more effectively with them. I hope that's helpful. And there are some leading edge modules that really speak to this adaptive communication coming up that I think you're going to find really helpful. Sorry, I didn't catch your name.
There's another question in the chat, and then we'll go to Dr. Riley afterwards. How do we balance between, I think she wants to say, providing best care for the patient and the owner with proper boundaries so we do not burn out?
Thank you. Sorry, and what was the name of the person that asked that question?
Cynthia.
Cynthia, thank you for your question. I think there is, we're definitely going to be doing another deep dive on time management. I think there's some really great answers there, Cynthia, in terms of creating boundaries and how we better manage our time and avoid burnout. Whether that be boundaries within a singular examination or boundaries more generally. But I think the point is, one of the key points I might have for you, and I'm not sure at what stage you're in your career, is not trying to be all things to everybody in every moment. And, being prepared to spread multiple problems over multiple examinations is one really great example. And we share some really great tips in Leading Edge on how to make the owner still feel like they're getting maximal value, while still creating some boundaries about what you're able to cover in that limited amount of time that they are paying for. So I'm hoping that will be really helpful for you. But, I'd say don't try to deal with too much in the moment, and either spread multiple problems over multiple consultations, or consider, if there's 6 problems and everything, is in your mind urgent, or at the very least in the client's mind as being very urgent, book them in. See if you can do an admission of that patient and, deal with it with when you've got more time on the procedure list. I'm not sure if that's helpful for you, Cynthia.
Great, thank you. Yes, Dr. Christopher Riley.
People just call me Chris, thanks. So this is just more for the people in the group, rather than a question for Michael, just encouraging people to post in the chat that we have online after your readings, because it's a good opportunity to engage and hear from people. I notice not many people have stepped up and put a little chat in there. So if you read something, just post in there. It gives us a chance to know each other and learn from each other a bit more. Just encouraging the team to post in our online chat. Thank you.
Yes, that's for the
Thanks,
community
Chris.
space. That's great.
Yeah, 100%. Don't feel intimidated or shy there. As we've discovered today, we're all in the same boat. We all understand one another. Please feel free to chime in our community space. And we can see a lot of people doing that already, but I would love to hear from you.
There's a few comments. One is wondering how this has evolved in a corporate. This relates to the previous question before Dr. Riley was they wondered, sorry, I'm losing wondering how this has evolved in a corporate environment as the AHA studies are pre-corporate. So
Yeah, it's a great,
yeah.
That was from Mary. Mary, that's such a great question. I would desperately love to see more current research done in this space, because I'm sure some changes have occurred. We do a lot of research internally at Lincoln Institute. We work with a lot of independent veterinary businesses. We also do some work from time to time with consolidated businesses. What I can say, just anecdotally for you, is there's still plenty of evidence out there that the majority of clients really value and appreciate our services that we're recommending, and typically the majority move forward and say yes. It would be around about 80% currently, with the data that we collect across multiple countries. And I think it's a really important thing that remember ourselves, is that around about 20% of rejection is actually normal. And it's super important that we don't base our sense of self-worth and the value of the services that we're providing on the 20% that are saying no, but rather base everything around the 80% that do. And they're not all giving us cards and buying us flowers, but the overwhelming majority of people really do value us. I hope that's helpful. But if you want to collaborate on a research project, I'd be very passionate in supporting that, that's for sure.
Thanks, Mick. Evelyn has a comment as well. She says, I wonder if client communication regarding costs changes or still applies in shelter medicine.
I think it's a great point to highlight, is there are different working environments for veterinary professionals where some of these rules don't apply. And shelter medicine, I would say, could be one area where the priorities for clients are different, and you might be seeing a different subset of people who would like you to focus on cost and cost-effective solutions. I think another great example, because I know that we actually have some production animal veterinarians in this pilot, is in farm settings. You know, unfortunately, there isn't that emotional attachment to the animals necessarily. I'm not saying that's the case for every farmer, but there's that commercial pressure to provide that veterinary care as cheap as possible. So in these instances, we've got to identify other motivating factors for these clients or people that we might be interacting with. If we use the example of a farmer, we need to adapt our communication in a way that speaks to the economic benefits of herd health and protecting genetic lines. We've got to think in ways that really tap into what matters to them as well. But it's a really great point, Arvo. It's not always the primary motivation being quality care, depending on what subset of pet owners or animal owners that we're interacting with. So thanks for the comment.
Great, thank you. Emily Lewin?
Yeah, I can just read mine out instead of just having you having to read it. So basically my understanding, Nick, is that you're saying that when clients say no to your recommendation, it's actually, and they say it's about cost, that actually underlying that is actually not money, but maybe the fact that they haven't been convinced of the importance of your recommendations yet. Is that what that section was about?
Yeah, it acknowledges the fact that for the majority of clients, when they're complaining about cost, there was some interesting research done by a veterinary business guru by the name of Mark Opperman that really explored this, that the majority of clients that are complaining about cost are only doing so because they haven't seen enough value yet. Yeah, it really identifies that there is a significant proportion of clients out there just looking for you. Your job is to convince them of the value and move beyond the price. Does that help?
My follow-up question then becomes, when you do get that no from a client, is there, I guess, there are some people who genuinely it is about money. And in that case,
100%.
You need to accept that and move on to your options B and C and work in the spectrum of care. But is there a way to tease out, and this might come later in the modules, whether there's almost a way to kind of skillfully recover from that? Because if there's clients that just need some more convincing, can you recover at that point, or do you kind of have to just accept, move on, learn from that, and apply something differently next time to a different client?
I think you've summed it up well in the latter approach, Emily. And I think that is run through a mental checklist. Articulated every single element of my treatment plan in a way that's really going to resonate for them and tap into that decision-making center of their brain. Have I moved beyond what the benefit is and described each of those elements in terms of an emotion that's really going to trigger that limbic response? And have I provided an opportunity for them to ask any more questions that they might have for anything that's outstanding? And if you've ticked all of those boxes, I think you can confidently move on to option B and perhaps ultimately option C. At some stage, there's a line in the sand, right? And that's our practice. And anywhere beyond that might be requiring a treatment waiver, or perhaps helping them find a practice that can provide them with the care that they're looking for at the cost they can afford.
Right. It's the art of veterinary medicine rather than the science in this case.
100%. You couldn't describe it better.
Thank you very much. Thank you.
Thanks for unmuting, Emily.
Thank you. Are there any other questions? I know there have been a few side conversations going in the chat, but if there are any other questions, please bring them forward.
I do see that Abul has a question. Well, there's two more questions.
Okay, let me look.
And by the way, folks, if you have to drop off, we know it's late in the evening for some of you. Please do so. We're not offended at all, but I'm happy to take any more questions.
Okay, so there is a question from Abul. Our veterinary profession and also human medical profession in whole, North America now, became fully commercial business like other business. Do you have any comments?
Do you know, Bill, what I feel is really important is we need to be thinking as leaders in our industry in particular, we need to be thinking holistically about provision of sustainable veterinary care for the longer term. And I think part of that holistic focus needs to be running a commercially sustainable practice. That's for certain. But what I would typically teach my veterinarians as a really proactive veterinary business owner was this: if we focus on what really matters to our clients, the rest will all fall into place. Yeah, if we don't let these fears and these voices get on top of us, and we stay in touch with our why, and we work as hard as we can to be the most influential advocate, and obviously work on delivering that medical care and preventative health care really well, the commercial part really takes care of itself. And it's certainly my experience in my practice, but I work with hundreds and hundreds of businesses. And it's a big part of our focus as well, as focus on what really matters. You know, as to what overlay perhaps corporate consolidation has had in terms of this focus, I can't tell you. I can certainly tell you, what many consolidators discovered was trying to run businesses by numbers and manage centrally and not treat people as individuals and perhaps a focus on what doesn't really matter. Found that wasn't a really successful approach. So I'm certainly pleasantly surprised to see so many global consolidators really starting to put people first. So I think it's an important part in the puzzle of a sustainable profession. We need all providers of veterinary care to be successful and sustainable commercially in order for this to be a great place for us to work in, for animals to continue to get the care they need.
Great, thank you, Mick. I have another question from Emma. It's a little bit long, so give me a moment here. How do you avoid clients getting upset and feeling all the options weren't presented to them, or alleging that you hid less expensive options and upsold them if you present the gold standard approach first? Just a moment, I have to scroll. First, and they consent, then later find out about alternatives and they could have tried that weren't as expensive. Even if you explain that this was the gold standard best approach and the reasons why.
Yeah, look, I'm mindful that veterinarians are working in multiple jurisdictions with different guidelines when it comes to spectrum of care, but it's a confusing place for veterinary professionals. You might have seen my commentary in the community space. And that is balancing informed consent out. And, fortunately, as I mentioned to you, the implications generally are far greater for omitting to discuss the more expensive and more premium healthcare options. This is usually what the regulatory bodies are being called into governance situations for. But yes, I would say we need to be open. We need to be open and say, look, I want to step through with you what I actually think is going to represent the very best healthcare path forward. Then after that, if you want me to step you through some of the alternative options that might represent cheaper paths, we can step through those as well. I think we need to be really open with our communication and make sure that we're meeting the requirements of our regulatory bodies. But I do think it's a really confusing space and a step-by-step approach rather than bombarding clients with 7 options at once. particularly if you're in a jurisdiction where, you know, you're being told, like we are in Australia here, in one jurisdiction, that we need to include euthanasia as one of those treatment options. I think that's confusing, distressing, perhaps maybe even unethical. So a staged approach, but perhaps with the full disclosure that there are other deeper elements that we can step through if you would like to. But most importantly, documenting those conversations that you're having. Yeah. You know, if you've done so and you've made it clear and you have stepped them through an inferior option, we've got to have really clear evidence that we actually have engaged in proper informed consent. So I think there are no clear answers, to be honest, but I wonder if that helps at all.
Great, thank you. Were there any other questions? The only other question, Mick, was if anyone had any further questions at a later point, is there an email address that they could send that to, or is the community space better?
Yeah, look, both. Yeah, if you'd rather not pose a question in the community setting, I'm really happy for you to email me directly. That's no problem at all. And we might just, I don't know whether we've got time now to post that into the chat, Denise. I've got so many windows open here. You could probably access my email and paste it for me more quickly. And yeah, Jennifer, I can see you're actually asking about the community space. That's on our community platform called VetHub. You would have received an email from VetHub earlier in the beginning point of this pilot, and it'll step you through those initial steps to gain access to the community space. But I'd say to any of you, please, if you've got a question, post it in there at any time, or if you'd like to address something privately with me, I'm really happy to help you out there and perhaps answer your questions if I can.
Great, thank you so much. Yeah, so sometimes when you're actually trying to find the community space, if you try to go back to the dashboard, and then it does show up, it's at the far bottom. So just scrolling a little bit might help. Any other questions before we end the evening? And I did put Michael's email in the chat if anyone
Thanks.
wants to take note of that.
And one closing thought, I did just put up the QR code there once more. If you could take some time to provide us with some feedback. There's only 2 questions on this survey and it shouldn't take you longer than a few minutes. But thanks once again, everybody. It's been fantastic to gather together, and thank you for your engagement.
Great. Thank you so very much for the presentation, Mick. This was fantastic. I hope everybody enjoyed it. We'll just hang on for about a minute or two in case people still want to grab that QR code. And I'm wishing everybody a great evening.